And vitamin D orchestrates your insulin in your body. That's right. Insulin is related to metabolism, maintaining a normal body weight, and blood sugar. Guess what? Vitamin D reduces the risk for diabetes. So if you have a loved one that is, struggling with being overweight and they have, pre-diabetes, tell your loved one, have your doctor check your vitamin D level. Woo! Everyone is struggling with good concentration, reducing distractions, having a clear mind. Your secret weapon? Yep, vitamin D level. Make sure you take some. So this is ultra short, and I've seen this over and over again. When I see people with, oh, doctor, I cannot focus, I check their vitamin D and I tell them, you're going to take your vitamin D, let's bring your level up to normal. And guess what? They say, whoa, what did you do? Is it in my brain? Is it my imagination? And I say, no. Vitamin D absolutely will help your brain function better. And if you struggle with poor concentration, that's all you need to do. Whatever your vocation, you want to measure the chocolate chip cookie dough measurements, or you are balancing the company's balance sheet, take a vitamin D. Now we come into something that I discovered. I used to work in Minnesota. And for 5 months, 6 months out of the year, we're in long winters and you really feel it. You're indoors all the time. You get a bit of sunshine. You're in below freezing temperatures for weeks on end, and you get seasonal affective disorder, or SAD. Seasonal affective disorder. And actually, one of the nurses alerted me to this because I was feeling like, oh, wow, I can barely drag myself to my clinic. And she said, Dr. Manek, you're suffering from SAD. And I said, I'm not sad. What are you talking about? And she says, no, I don't mean you're sad as in depressed. I think you are seasonal affective disorder. And, she was very wise. And it's linked to a lack of sunshine and vitamin D deficiency, seasonal affective disorder. Yeah, there you are. That's another one to chalk up in your list. So related to concentration, seasonal affective disorder, vitamin D is a key nutrient for your nerve health and brain health. And that brings us to something that is also top of mind, pun intended, to reducing Alzheimer's and dementia. So if you have loved ones who are struggling with or are scared about getting dementia, or you have somebody in your close circle of family that is struggling with dementia, make sure you have vitamin D, and in your own self too. You're going to do yourself a big favor and maintain your nerve health and brain health. Vitamin D is pivotal in muscle health and preventing against myalgia, which is fibromyalgia, weakness, and pain. So if I see patients with fibromyalgia, which is very common in rheumatology, it's the first thing I do. I really check their vitamin D and bump it up to normal levels. It's the best thing you can do. You don't need drugs. You can take them if you want, but make sure your vitamin D is checked. So if you're struggling with feeling weak, feeling myalgias, this pain and achiness, tell your doctor, please check my vitamin D level. Another one I found in my mental gymnastics of vitamin D is that folks who struggle with breathing, asthma, and COPD, which is chronic obstructive pulmonary disease, related to smoking. Well, vitamin D reduces your risk for getting a flare of breathing difficulties, such as asthma attack or infections such as COPD and obstructive pulmonary disease flare. You know, you're breathing, you need your nebulizer, but it reduces that flare or breathing difficulties. If you're suffering from asthma and chronic obstructive pulmonary disease, well, vitamin D, a sufficient level of it, reduces your risk of breathing flares, asthma attacks, and also needing nebulizers. So make sure if you're finding that you're ending up in the emergency room with asthma attacks and you need a nebulizer, make sure to tell your lung doctor, check my vitamin D level, please. Make sure you know it's sufficient level. That's all you might need to do. If you have a loved one struggling from cancer, it turns out this is really amazing. The National Cancer Institute of the United States lists this as a benefit of vitamin D level. It reduces colon cancer and others like breast and prostate tumors. So if you're worried about cancer prevention, there you have it. Vitamin D is your ally. So I got all of these and more in my 5-minute mental gymnastics of what vitamin D could do for you. And there's more, but I have lots of things to do, so I ended it there. Okay? So I encourage you, the first task that you want to do upon watching these videos is work with your doctor, partner up with your doctor, and make sure that you have enough vitamin D and take it every day. Okay? This is as powerful as any drug that you're going to take. So, while we're on the subject of science and informing us how to live healthy lives, I've talked about vitamin D and its impressive range of effects in your body, from the brain to your heart health, blood pressure, metabolism, and reducing insulin resistance, regulating your body weight, bone health. Well, why should you care? The problem is that vitamin D deficiency is under-recognized. What do I mean by that? Well, you know, I'm a rheumatologist, so immune health and arthritis health, how to keep my patients healthy while they have chronic inflammation in their joints is topmost in my mind. Well, I did an exercise. Over 6 months, I was very rigorous in checking vitamin D levels in all of my patients, and I see hundreds over a 6-month period. And this is what I found, and I want to share this with you. About 80% of the patients I checked in my clinic for vitamin D level were deficient. That is, they were under the normal level. 80%. That means 8 out of 10 people I measured vitamin D level had below the normal levels. That's really serious. And I was alerted that I am not rigorous in my own practice, and now I do this 100%. Everyone gets the level checked. So 8 out of 10 patients were deficient, and I replaced it. I informed them this is the minimum thing I can do, rather than more prescriptions for steroids and more medications, replace the vitamin D. 20% of the people I measured over that 6 month barely reached minimum level of vitamin D, okay? Which is it's measured in America, nanograms per mil, nanograms per cc, mil is a cc. So 30 to 90 nanograms per cc is considered an ideal range. and about 20% reached around 30, 32. So they reached a minimum. And no one, zero, no one reached a robust level of vitamin D, which would be 50, 50 nanograms per cc. I like to push them even higher, 60, 70, or even 80 nanograms per cc. It's natural nutrient. You do not need to be scared from it. And so this is the big lesson for me as a doctor, that look, it's under-recognized. Vitamin D deficiency is under-recognized, and it is a very easy thing to do to get our patients up to a normal level. Okay? So I hope that helps you about how science can inform us to live properly, robustly, naturally, and to do the minimum that we need to get our infection under control and to reduce the time to recovery. It is really, truly the low-hanging fruit in health, vitamin D. And in the next few videos, I will talk about 2 to 3 other things you can do very easily. That's in your kitchen, already in your counter, that will help you. Okay, until then, be well. I want to have a disclaimer for this videos, is that they are for informational purposes. I don't know your health or your personal circumstances. Please always work with your own personal physician and your primary care doctor. Link arms with them, ask good questions, and if you do not know your vitamin D level, get it measured and work with your doctor, okay? Thank you.